In addition, as we noted in the beginning of the
thank you, Emily. So I'll just try to share my screen. Okay, can you see my screen?
Go ahead.
I thank you. So I'll just, on behalf of the Secretariat, which is active of PHEOC webinars, and also will give a brief overview on the number of webinars and the topics that have been covered, the participation and series and certification of the webinars, the Discord community performance, and also what to expect in the coming year, 2021. So to give a background on why we started the EOC webinars, firstly, the high numbers of cases and geographic spread of COVID-19 pandemic severely tested the coordination of information and resources by the PHEOCs across sectors and layers of response. Therefore, a virtual learning platform for country-level support became necessary to increase PHEOC's management capacity. This virtual platform leverages on the technical expertise that exists at Africa CDC, WHO, WAHO, US CDC, Public Health England, RKI, and also a growing list of all collaborating partners. The learning platform adopted a hub and spoke knowledge sharing approach, which is led by experts in public health emergency management. And this learning platform uses technologies to develop an online community with national and subnational level PHEOCs in Africa. These teams have actually become part of a learning community where they receive mentoring and feedback from expert teams. And together we have been able to enhance learning and sharing of knowledge with the priority goal of optimizing the use of PHEOCs in containing the COVID-19 outbreak in Africa. But also it's worth noting that the PHEOC webinars do not stop with COVID-19. So what happens after COVID-19? The community will transition into a continuous learning platform for PHEOC teams in the African continent and the WHO Eastern Mediterranean. So the objective of the PHEOC webinars is to build capacity in EOC management for COVID-19 through creating an online community of practice for Public Health Emergency Operations Center during COVID-19 pandemic. Specifically, the objectives look at identifying modalities for rolling out the online learning platform, give participants the ability to connect, learn, and share expertise with each other, build on existing tools, systems, and platforms to incorporate best practices, collect resources and inform future EOC learning, advocate the use of PHEOC and incident management system for response in settings where there are no PHEOCs. So to give a brief overview on the number of webinars and the topics that we have covered so far, we have conducted a total of 29 webinars to date. That is from the 4th of June, 2020, where we had our first webinar session till today, which is 17 December 2020. So this session marks the 29th webinar. Webinars are held weekly on Thursdays at 3 p.m. Eastern African time and with a duration of 70 minutes. The structure of the webinars take two parts in each session, which include a topic-specific presentation from experts in a particular field and also a country experience. So this slide shows us the topics that were covered for the first 11 webinars. And these topics were actually listed when we're coming up with the structure of the webinars. But then moving forward, we considered participant suggestions on the next webinar topics. And from the feedback we got, we saw a need of doing a deep dive into the topics, hence the commencement of the series. So the first series was on incident leadership, and we ran 6 sessions under the incident leadership series. That included topics on decision-making, situational awareness, effective communication, management by objectives, team building and management, and inspiring and motivating. And after the incident leadership series, information management series, where we held 7 sessions. And the topics under this series included introduction to information management, data governance, emergency management and critical information, watch mode operations, public health emergency operations center information products. These included CTREPs, rapid risk assessments, and incident action plans. And the last session under this series was PHEOC tools, that were GIS, data management, and display tools. And the last series of the webinar series of the year was the Multisectoral Coordination, which is the one that is concluding today. We have run 5 sessions under the series. We have looked at disaster risk reduction, multisectoral coordination preparedness, One Health, and multidisciplinary approaches to information management, role of emergency management, and the last session, which we just concluded now, which is developing and using concepts. So just to quickly go through the participation when it comes to the webinars for the past 28 webinars. So this slide shows us the number of registrants that we've had since the beginning of the webinars. So the first series, which was webinars 1 to 11, we had a total of 1,733 registrants, followed by incident leadership series with 103, information management with 362 webinars. But during the information management series, I think, as you can see, the drop of registrants to 1,000 and of the series. And as of today, we've had a total number of registrants, or a total number of 1,024 registrants for the Multisectoral Coordination series. And in terms of attendance, this slide shows us the average number of attendees per webinar series. For webinar 1 to 11, we had an average of 200 attendees. For the leadership, 236 average, that is. And for information management system series, we've had an average of 200 attendees per webinar session. And for the multisectoral coordination, we had 223 attendees per session. It's worth to note that the highest attendance was observed responsive management webinar, and we had the lowest attendance for watch mode operations, and this was due to the change in the link during the information management series. Since the beginning of the webinars, we've had an average of 214 attendees per webinar session. At the participation, this slide shows us the percentage of attendance by region. We use the WHO regions to show the percentage of attendance. So as we can see from the table, the region that was highly represented during the webinars was Afro, followed by EMRO and Euro. And the last row in this table just shows us that most of the attendees are actually in African countries, that is, who are based in either the WHO Afro region and a part of. This slide shows us the most represented countries per webinar series. So across the 4 series that we've run, we represented countries with Nigeria being the most represented in all webinar series, and the other countries apart from Nigeria that we have noticed are highly represented, include Kenya, Ethiopia, Ghana, Uganda, and the US. Move on move to the specialties, where this represent specialties per webinar series. And across the 4 webinar series, doctors have been highly represented, and other professions that have been represented during the webinar series include EO officers, students, epidemiologists, consultants, and health officers. To the series and certification of the webinars, we saw to give out certificates to our participants who attend our webinars, and this commenced during the information management series, where we have awarded 46 participants who attended and completed the quizzes. We have awarded certificates to these 46 participants. And also just to highlight that participants of the Multisectoral Coordination webinar certificates once the quiz is completed. And just to highlight that there will be one. Thank you, and over to you, Emily.
Great, thank you. Really appreciate that overview as a helpful guide for where we've been and where we're going. So once again, I just want to thank all of our panelists and presenters and everyone who has joined to listen in sessions. We hope that you found it full and that you're able to take elements and indirect from here in the work that you do every day. So with that, I think we can conclude our webinar series for 2020. We do wish everyone a year. We look forward to seeing everyone here in 2021. All the best, everyone, and have a wonderful morning, evening, or afternoon. Day. Bye.
Thank you, everyone.
Thank you.
Bye. Thank you.
Thank you.